Hey, Dr. Heather here, and today I'm diving into the world of facial rejuvenation. I'll be introducing you to an innovative, gentle, non-surgical way to revive the youthful vibrancy of your face. But before I do, let me ask you a few questions. Do you or someone you love notice deepening lines in the face as the years go by? Have you ever thought of undergoing a facelift or any surgical procedure for your face? Or maybe you've tried some treatments, but the results weren't as long-lasting or as natural-looking as you'd hoped. What if I told you there's a method to effortlessly refresh your facial contours, reduce those deep-set lines, and add that plumpness back, all without going under the knife, and without compromising your natural beauty or your natural expression? Sounds promising, right? Well, stay tuned because I'm about to unveil this game changer. They're called aesthetic fillers, and in this video, I'm going to answer the most frequently asked questions I get from my patients about fillers to see if an aesthetic filler treatment may be right for you. I can't wait, so let's get started. So, what are aesthetic fillers and how do they work? Aesthetic fillers are gel-like substances composed of hyaluronic acid injected under the skin or into the dermis to restore volume, smooth out lines, and enhance facial features. They work by adding fullness to areas that have thinned due to aging. What do aesthetic fillers treat? They're designed to treat deeper lines, enhance lips, lift cheeks, and improve other facial contours that may have lost volume over time. How do they work, and how are they administered? Fillers work by plumping up the targeted areas. They're injected directly into the skin using a fine needle with the depth depending on the desired outcome. Over 2 to 4 weeks, the hyaluronic acid attracts water to it, and the filler gently expands or plumps up the area it was injected. Who are they best for? Fillers are ideal for individuals looking to address signs of aging, enhance facial features, or restore volume without undergoing surgery. Are they safe? Yes, aesthetic fillers are generally considered safe when administered by qualified professionals and injected into only appropriate areas. Are there any side effects? Common side effects include temporary redness, swelling, or bruising at the injection site. These usually resolve within a few days. Is the procedure painful? While some discomfort is possible, many fillers contain a numbing agent to minimize pain, and we apply additional topical numbing as needed. How will I feel immediately following the procedure? You might experience mild tenderness, swelling, or redness, but these effects usually subside within a few hours to days. Are they FDA approved? Yes, the aesthetic fillers that we use, which are all of the Allergan-branded fillers, including Juvederm, Volbella, and Voluma, are FDA approved for specific uses in facial rejuvenation. How long does it take, and when will I notice a difference? The procedure is relatively quick, often taking 30 minutes to an hour. Most people see immediate results, with full effects visible in a couple of weeks. How long will the results last? Results vary based on the type of filler and individual factors, but can last anywhere from 6 months to over a year. How are fillers different from BoTox? While both address signs of aging, fillers work best with deeper lines, restoring volume and contouring, whereas BoTox relaxes the muscles that cause fine lines during facial expression, preventing creases from forming. What will aesthetic fillers not do? While they can enhance and rejuvenate, fillers won't provide the same lifting effect as surgical facelifts or fundamentally alter your facial structure. Now, while aesthetic fillers are safe if administered by a trained professional, they may not be the right procedure for every condition and for every person. So to see if an aesthetics filler treatment may be right for you, just text us for an evaluation at 239-323-5509. That's 239-323-5509. Thank you for taking your time with us today. I'm Dr. Heather, and we just want to help you live your best life ever.